Good morning, guys. All right, we're all sparkly. Today we're going to answer a very important question. Does TRT cause aggression? Now, I was recently interviewed by The Telegraph because female HRT is going to be available across the counter. Wonderful news. But is estrogen versus testosterone a fair comparison? Because they were interested to hear if I thought testosterone should be available across the counter. Disappointingly, the obvious answer is no. Why? Because it can be abused. It is abused, and I think over-the-counter testosterone will be abused even more than going underground to the local gym bro to get your gear. It's legitimizing something that should not be legitimized to the point that it's a casual conversation. I'm going to do a bit of testosterone, not realizing that testosterone is going to suppress the HPG axis, and you are going to render yourself a lifetime of testosterone replacement therapy because you thought it was safe. So does that mean testosterone is dangerous? No, obviously not. A well-balanced TRT protocol is a well-balanced TRT protocol and will help facilitate growth and repair for long-term physical and psychological well-being. But as with every hormone, you can have an excess, and that has deleterious health consequences. So what happens with high testosterone? Well, it can cause high blood pressure, a rise in hematocrit, lipid dysregulation. All of these things will have a negative impact on your cardiovascular system. We quite like the heart, so we want to keep it healthy with healthy hormone levels. We don't want to have a pair of bangers, do we? So we want to carefully titrate your dose of testosterone according to effect. So the idea of having an over-the-counter testosterone therapy and not having access to regular monitoring and a clinician that knows what he's doing is nonsensical. So we're going to talk about the association of testosterone and aggression. How should you feel on testosterone replacement therapy? A well-balanced TRT protocol, which is what? Microdosing TestSIP and HCG. As you guys know, we feel, we believe, we know that this is the most effective way of achieving stable male androgen levels. To do what? Help facilitate normal physiology. To do what? Restore balance within the body. For what? Yeah. Ad nauseum. Another key word I say all the time. So, testosterone's role in aggression. Testosterone, drive and determination. It also metabolizes to estrogen, so empathy and insight, and DHT, aggression and libido. You want the correct ratio of testosterone to estrogen to DHT. For what? Balance. We want you to have a proportional response, a considered response to the situation in front of you. What we want to also do is balance your anabolic hormones, which we'll actually call your calming hormones, against your more stimulatory neurotransmitters, adrenaline and noradrenaline, and the catabolic hormone cortisol, that are going to fire. They're firing constantly to do what? To keep you safe, to protect you from danger, to assess a threat. We want to stay alive, and our survival instincts, they need adrenaline, noradrenaline, and cortisol to run away from that saber-toothed tiger, to go hunt, to do all the things that we need to do. But we don't really need to run away from saber-toothed tigers or hunt nowadays, should we? Well, it's an interesting concept, isn't it? And lots of people are now advocating hunting because it's getting you back to that primitive state that we no longer exist in. We are living in a perverse, civilized world A world full of psychological stress. And as I've said before, you release the same hormones that you do with psychological stress as you do with physical stress. And disappointingly, as you're not using those hormones appropriately, physically, they build up and they build up and they build up. And what happens to your sleep? It becomes dysregulated. When do anabolic processes predominate? Yeah, you guessed it, at night time. So if you build up a psychological stress and it doesn't get released physically, you're going to dysregulate your anabolic hormones and you're going to have low testosterone as a result of excess psychological stress. So interestingly, with low testosterone, people often complain of a level of irritability. And that is because of this firing of adrenaline, noradrenaline, and cortisol that isn't balanced with your anabolic hormones because you're doing things that dysregulate this process. Think of it as a seesaw effect. As I said before, adrenaline, noradrenaline, and cortisol will fire whatever happens. And you want to balance them with your calming hormones, testosterone, DHT, and estradiol, in the correct ratio. Now, it's safe to say that testosterone does affect the amygdala, the decision making, the risk part of your brain. It's one of the reasons with high testosterone, teenagers are plonkers. Not only are they trying to make sense of the world because the world is a perverse, peculiar place, because we're no longer hunting and gathering, that high testosterone is affecting their risk decisions. So they're more likely to take risky decisions. And if consciousness is about subjective appreciation of change, you have to do something more drastic to elicit a response with high testosterone. Because along with the high testosterone comes high dopamine. And we're kind of thinking, yeah, I like a bit of high dopamine. I like my dopamine. It's the reward chemical. It's the pleasure chemical. But to elicit a response, that person with high testosterone and high dopamine as a response is going to have to do something dramatic to appreciate change. Add in high estrogen with high serotonin, and again, potential downregulation of the happiness chemical. It's not a good state to be, is it? We want to be able to experience fluctuations, which is why I always talk about the glass half empty, glass half full discussion. Low testosterone, glass half empty, terrible. High testosterone, glass half full. Sounds wonderful, but as I just said, dysregulation happens as a result because we want to be glass half empty, glass half full, and have the conscious thought, the decision to be glass half full, don't we? So we think about antidepressants. You're depressed. You need an SSRI. You need to raise your serotonin level. We want to keep you happy. As we've just said, doesn't really work like that. And lots of people have a blunted effect because they have persistently elevated serotonin. And they're uncomfortable with that. Why? Because life is about subjective appreciation of change. So excess testosterone. Yes, as we've just said, testosterone influences the decision-making part of the brain, the amygdala. So too much testosterone, you can make some bad choices. Does it make you aggressive? No, only you can make yourself aggressive. If you're a bit of a plonker, you'll be aggressive. That's a sad fact, but yeah, it is what it is. So, testosterone. Let's think of it actually as the calming hormone, counterbalancing the catabolic hormones and the neurotransmitters that are firing all the time. So testosterone does not cause aggression. You cause aggression. If your TRT protocol is making you aggressive, it's likely that you're on the wrong TRT protocol. Either your dose is too high or your injection frequency is not frequent enough. And as we've said before, we subscribe to microdosing because it is the most effective way of mimicking natural physiology. You can achieve stable levels with a less intensive injection frequency, but what we actually want to do, we want to mimic physiology. So you might have stable levels, but actually a small daily injection of Testosterone and HCG does create that spike of testosterone in the morning, that natural diurnal pattern. So your anabolic processes occur over the night. You're repairing from the day to prepare for the next day. So you have that high testosterone and cortisol in the morning to do what? To be active. So microdosing testosterone, cypionate and HCG is the most effective way of doing that. You need to carefully titrate your dose according to effect to achieve what? Normal physiology. High testosterone is not a good place to be. Paradoxically, lots of people don't feel good with high testosterone. They feel uncomfortable. There's a small cohort of people who do feel good. However, what are they doing? They're normalizing the abnormal. And we don't want to do that. We want to be considered, empathetic. We want to be able to fight and fornicate, but only when the time comes. Take care, earn your reward.